disease is the leading cause of death here in the United States, and that's according to the Centers for Disease Control and Prevention.
The month of February is recognized as American Heart Month, and it's dedicated to spreading awareness about heart disease risk factors and prevention.
Our Autumn Klein joins us live now from outside of Trident Medical Center, where they have recently seen an increase in heart disease cases.
So, Autumn, you spoke to a cardiovascular surgeon there at Trident. What did they share with you?
Shelby, Katie, I spoke with cardiovascular surgeon Dr. James Benner here at Trident, who says that in the last year they have seen what he calls an explosion in the number of heart disease cases. He says that they went from treating an average of 15 hearts a month to now over 20 a month. Not only has the number of cases increased, but they are also seeing more young patients than they are used to.
I was always operating on everybody older than me. Everybody was always 70, 80s. Now I'm seeing a lot of people that are 10, 15 years younger than me, which is really surprising. A lot of younger patients are undergoing bypass, undergoing vascular procedures. So it's definitely a big pendulum swing. And some of that I think is related to the prevalence of diabetes, some of it's smoking, some of it's inactivity, some of it's kind of poor diet choices, and genetics plays a role. So it's definitely, but the pendulum has definitely swung to younger patients.
Benner says that the sooner you catch heart disease, the easier it is to intervene. Some healthy and preventative measures you can start doing now include watching your diet, limiting your intake of red meat, and stopping or avoiding smoking. Benner says he's also seen some of the best results with increased exercise. There are fortunately many treatments available for heart disease, such as medications, surgeries, and stents, but Benner suggests start paying attention to your health no matter how young or old you may be. He says that if you have any family history of heart disease or a heart attack, he suggests getting with your primary care provider as soon as possible so you can start checking. Coming up at 6, we'll hear more from Dr. Benner on the topic of heart disease. Live in North Charleston, Autumn Klein, Live 5 News.